Today, pediatric doctors and nurses at Anderson Hospital gathered to talk about sickle cell disease in children. Ben Lockridge has the story.
Dr. Melissa McNall of the University Medical Center in Jackson paid a visit to Anderson Hospital to draw more attention to sickle cell disease in children to better aid healthcare providers when encountering the disease. She says while pain is the most obvious symptom, it's not the only alarming issue.
It's a blood disease, but it carries the red blood cells that carry oxygen around the body are where the problem is. And so if those cells don't work correctly, you can't carry oxygen around the body, so all of the organs in the body are affected. The brain, the heart, the lungs, you name it.
McNall says one of the biggest red flags of sickle cell disease is a high temperature.
Fever in a patient with sickle cell disease can't be treated like fever in somebody else. We lose at least one child per year in the state of Mississippi to sepsis, overwhelming infection. And what those kids present with is like what all the other kids present with, fever, and they don't feel well. And they need to be overtreated.
McNall insists that parents not be intimidated by doctors and insist when a high fever is present to check for sickle cell disease.
So we teach our parents what to expect, and I write to the primary care doctors what to expect. But, you know, we're talking about children presenting to emergency rooms all over the state. And emergency room doctors they kind of have to know everything. And so how can they know everything? So I teach the parents, if they're not following through what needs to be done, you know, please mention that to the doctor. Have them call us. We're on call 24/7.
McNall added that sickle cell disease is an issue she loves to hate.
I think sickle cell disease is an area with such need. Not much was done. Very little progress was made in sickle cell disease, really till the late 1980s and into the 1990s. So it's a disease, unlike, it often gets compared to cystic fibrosis. CF has about the same numbers. It's inherited the same way from parents who have a trait. And the difference is the progress we've seen made in that disease, we haven't seen in sickle cell disease.
Ben Lockridge, Twin States News.
And Dr. McNall says that checking your child for sickle cell disease is as simple as a blood test.